don't stop. Don't stop. Don't stop. Don't stop. Don't stop. Don't stop. Don't stop.
Surface marking of arteries of lower limb. Femoral artery. It corresponds to the upper 2/3 of a line joining the following 2 points. Midingeanal part, a point midway between the anterior superior iliac spine and the pubic symphysis, Fig 14.1. Adductor tubercle, it lies at the lower end of the cord-like tendon of the adductor magnus. The tendon can be felt in a shallow groove just behind the prominence of the vastus medialis when the thigh is semiflexed, abducted, and laterally rotated. The upper 1/3 of the line represents the upper half of the artery lying in the femoral triangle. The middle 1/3 of the line represents the lower half of the artery lying in the adductor canal. The lower 1/3 of the line represents the descending genicular and saphenous branches of the artery. Profunda femoris artery first mark the femoral artery. The profunda artery is then marked by joining the following 2 points on the femoral artery, Fig 14.1. First point 3.5 cm below the midinguinal point. Second point 10 cm below midinguinal point. The artery is slightly convex laterally in irs upper part. Popliteal artery. It is marked by joining the following points. First point, at the junction of the middle and lower thirds of the thigh, 2.5 cm medial to the midline on the back of the limb, Fig 14.2. Second point, on the midline of the back of the knee. Third point, on the midline of the back of leg at the level of the tibial tubercity. Superior gluteal artery mark the following points. First point at the posterior superior iliac spine. Second point, at the apex of the greater trochanter, Fig 14.3. The superior gluteal artery enters the gluteal region at the junction of the upper and middle thirds of the line joining points, first, and second. Inferior gluteal artery, mark the following points. First point posterior superior iliac spine. Second point ischial tubercity. Then mark a third point 2.5 cm lateral to the midpoint of the line joining first and second points. The sciatic nerve enters the gluteal region at this point. The inferior gluteal artery appears just medial to the entry of the sciatic nerve, Fig 14.3. Anterior tibial artery. It is marked by joining the following 2 points. First point, 2.5 cm below the medial side of the head of the fibula, Fig 14.4. Second point, midway between the 2 malleoli. The artery passes downwards and slightly medially. Posterior tibial artery. It is marked by joining the following 2 points. First point, on the midline of the back of the leg at the level of the tibial tubercity. Second point midway between the medial malleolus and the tubercle caneus. Dorsalis pedis artery. It is marked by joining the following 2 points. First point, midway between the 2 malleoli. Second point, at the proximal end of the first intermetatarsal space, Fig 14.4. Medial plantar artery. It is marked by joining the following 2 points. First point, midway between the medial malleolus and the prominence of the heel. Second point, on the navicular bone which lies midway between the back of the heel and the root of the big toe. The artery runs in the direction of the first interdigital cleft, Fig 14.5. Lateral plantar artery. It is marked by joining the following 2 points. First point, midway between the medial malleolus and the prominence of the heel. Second point, 2.5 cm medial to the tubercity of the fifth metatarsal bone, Fig 14.5. Plantar arch. It is marked by joining the following 2 points. First point, 2.5 cm medial to the tubercity of the fifth metatarsal bone. Second point at the proximal end of the first intermetatarsal space, 2.5 cm distal to the tubercity of the navicular bone, Fig 14.5. The arch is slightly curved with its convex directed forwards. Veins. Femoral vein. Its marking is same as that of the femoral artery, except that the upper point is taken 1 cm medial to the midinguinal point, and the lower point 1 cm lateral to the adductor tubercle. The vein is medial to the artery at the upper end, posterior to it in the middle, and lateral to it at the lower end, Fig 14.1. Great saphenous vein. It can be marked by joining the following points, although it is easily visible in living subjects. 1. First point, on the dorsum of the foot at the medial end of the dorsal venous arch. 2. Second point, on the anterior surface of the medial malleolus. 3. Third point, on the medial border of the tibia at the junction of the upper 2/3 and lower 1/3 of the leg. 4. Fourth point at the adductor tubercle. 5. Fifth point just below the center of saphenous opening. Small saphenous vein. It can be marked by joining the following points, although this vein is also easily visible in its lower part, Fig 14.7. First point on the dorsum of the foot at the lateral end of the dorsal venous arch. 1. Second point, behind the lateral malleolus. 2. Third point, just lateral to the tubercle caneus above the lateral malleolus. Fourth point, at the center of the popliteal fossa nerves. Femoral nerve. It is marked by joining the following 2 points. First point, 1.2 cm lateral to the midinguinal point. Second point, 2.5 cm vertically below the first point, Fig 14.1. Sciatic nerve. It is marked by joining the following points. First point, 2.5 cm lateral to the midpoint between the posterior superior iliac spine and the ischial tuberosity, Fig 14.3. Second point, just medial to the midpoint between the ischial tuberosity and the greater trochanter. The third point, in the midline of the back of the thigh at the junction of its upper 2/3 and lower 1/3, i.e. at the apex of the popliteal fossa. Tibial nerve marked the following points. First point, in the midline of back of the thigh at the junction of its upper 2/3 and lower 1/3, i.e. at the apex of popliteal fossa. Second point, in the midline of back of the leg at the level of tibial tuberosity, Fig 14.7. Third point, midway between the medial malleolus and tubercle caneus. The line joining 1 and 2 represents the tibial nerve in the popliteal fossa, and the line joining 2 and 3 represents it in the back of the leg. Fig 14.8, tibial and common peroneal nerves. Common peroneal nerve. It is marked by joining the following 2 points. First point, ai the apex of the popliteal fossa, Fig 14.8. Second point on the back of the fibula. At the lower end the nerve turns forwards and ends deep to the upper fibers of the peroneus longus. Deep peroneal nerve. It is marked by joining the following 2 points. First point, on the lateral aspect of the neck of the fibula, Fig 14.4. Second point in front of the ankle, midway between the 2 malleoli. Third point, first interosseous space. The nerve lies lateral to the anterior tibial artery in its upper and lower thirds, but anterior to the artery in its middle third. Superficial peroneal nerve. It is marked by joining the following 2 points. First point, on the lateral aspect of the neck of the fibula, Fig 14.4. Second point, on the anterior border of the peroneus longus at the junction of the upper 2/3 and lower 1/3 of the leg. At the lower point the nerve pierces the deep fascia and divides into medial and lateral branches. Medial plantar nerve. It is marked in a manner similar to the medial plantar artery, Fig 14.5. Lies lateral to the artery. Lateral plantar nerve. It is marked in a manner similar to that for the lateral plantar artery, Fig 14.5. Lies medial to the artery. Miscellaneous structures. Saphenous opening. Its center lies 4 cm below and 4 cm lateral to the pubic tubercle. It is about 2.5 cm long and 2 cm broad, with its long axis directed downwards and laterally femoral ring. It is represented by a horizontal line 1.25 cm long over the inguina 1 ligament, 1.25 cm medial to the midinguinal point, Fig 14.1. Superior extensor retinaculum. The retinaculum is about 3 cm broad vertically. It is drawn from the anterior border of the triangular subcutaneous area of the fibula. The lower part of the anterior border of the tibia, running medially and slightly upwards, Fig 14.9. Inferior extensor retinaculum. 1. The stem is about 1.5 cm broad. It extends from the anterior part of the upper surface of the calcaneum to a point medial to the tendon of the extensor digitorum longus on the dorsum of the foot. 2. The upper band is about 1 cm wide, and extends from the medial end of the stem to the anterior border of the medial malleolus, Fig 14.9. 3. The lower band is also about 1 cm wide. It extends from the medial end of the stem to the medial side of the foot, extending into the sole. Flexor retinaculum. It is about 2.5 cm broad and extends from 1. The medial malleolus 1. The medial side of the heel, running downwards and backwards, Fig 14.10.